Welcome back to Beyond the Stethoscope. When it comes to our health, there's nothing more comforting than knowing we're in the care of people who are passionate about keeping us safe and getting us back on our feet. Today, we are joined by Megan Odell. She's the Regional Director of Quality, Safety, and Patient Experience at Mercy Fitzgerald and St. Francis Hospitals. She's here to pull back the curtain on what it takes to deliver not just care, but exceptional quality for every patient who walks through their doors. Megan, thank you so much for joining me today.
Thank you. Thank you for having me. I appreciate it.
Absolutely. Yes, I'm excited to become more educated by you. Thank you. About what it means. Let's start with your role and, what does that entail? How long have you been in the role? I would just love to get your background.
I've been in the role since 2018. I've been in healthcare since 2010. I oversee quality, regulatory, patient safety, and patient experience. So it's a huge umbrella, but it basically means that we are providing our patients with the most optimal quality, high-performing care. Quality to me means that we are limiting patients from having complications, that we're getting them back to being themselves and back into the community.
That's amazing. Yeah, and through this podcast series, I've gotten to learn a little bit more about the community you serve, and I know that these hospitals play such a big role in the community, meeting people where they are, like you're saying, when it comes to your role, providing exceptional care. So let's talk about some of the accreditations, because me as a patient, it's something that I just don't think about, and maybe I even take for granted when it's a great hospital experience like what you provide. So what are some of the accreditations that you have, and what does that mean as a patient when I see that?
Accreditation means that you are performing at the most optimal evidence-based standards. And it's also part of maintaining compliance with CMS. So a lot of our healthcare is funded by Medicare and Medicaid. And part of that is to ensure that you're meeting those standards. And so we take it a step further. And that's what it means when we're Joint Commission accredited, or if we partner with entities such as Leapfrog or American Heart Association. Those are entities that say, okay, the reg says X, Y, and Z, but you're going to perform at even the top tier level. And so that's what it means to be accredited. To have the gold seal means that we've went through a process of validating the care that we provide to our patients and that we're meeting those standards and even further than that.
That's amazing. Yeah, just such a nice thing as a patient to see and to hear and learn about that, you're in good hands, but it's like the utmost.
It's the utmost care.
I love that. So when we see the Joint Commission, accredited by the Joint Commission, can you just kind of expand on that just a little bit for me?
So Joint Commission accreditation means that we are performing at evidence-based standards, that they are taking the federal regulations and they're adding rules to them. So what that means is that we have been surveyed. We've had someone come and inspect our facilities. We've had someone inspect our work, our patients, and that we have been accredited by Joint Commission. It occurs in either 3-year cycles for the hospital, and sometimes every year cycle for certain things such as our stroke accreditations or our sepsis accreditations.
Oh yeah, both very serious issues. And when it comes to sepsis, so something I was reading a little bit about before we started our podcast today, the CLABSI accreditation, does that have to deal with sepsis? Can you expand on that a little bit more and what that means?
We were recently recognized by Becker's as having one of the lowest CLABSI rates. So a CLABSI is a central line bloodstream infection. It's a complication that occurs in hospitals when you have patients that need a line that directly goes into their veins, and bacteria essentially travels and gets into their organs, and it leads to organ failure, it leads to death. So it's a very serious complication. It also causes patients to stay in the hospital a lot longer than they need to, and it also costs the patients in the facility a lot more money to provide care for these patients. So we went an entire year without having a central line bloodstream infection, as well as a Foley infection, which is a CAUTI. And so we were recognized for that. And so we've celebrated that among our teams. We had a huge celebration because that's very hard to obtain.
I was going to say, the level of detail and care and
it means that you're maintaining your sterile techniques, that you're inserting them when they need to be inserted, that you're getting them out when they need to be removed, and that patients are receiving the best care, and it's all based on evidence standards and maintaining those techniques that ensure that they don't have sepsis, that there's no organ failure or death.
So in your role, when it comes to something like that you just broke down, like, I mean, just, it's crazy the amount of detail that has to be covered, like you said, to keep the sterile environment and no unnecessary injections. So what does that mean, like, in your day-to-day life? Like, do you oversee the teams that...
Yes.
Okay.
So I oversee the teams that look at them every day, that, evaluates that, yes, this is needed, or no, it's not. Or, hey, instead of this IV antibiotic, can we try this oral antibiotic so that they don't have the central line risk anymore? I also oversee the team that goes out and validates that we are meeting the standards, that we're maintaining technique, that our dressings look good, that patients are aware of what the risks are. And so that's part of what I oversee day to day.
Wow. That's
and it's part of our safety huddle every day. So every day we talk about it. It's not something that's just mentioned monthly. It's an everyday talked about subject.
So the safety huddle, tell me more about this.
So our safety huddle is part of our process to bring awareness to any situation that may be unsafe, but to also just talk about generally what's going on. How many patients do we have? How many patients are in isolations? How many discharges do we have? And it kind of maintains that flow of patients through the ED to inpatient to out, any barriers that the team may need. Is there a unit that maybe needs additional wipes today because they have higher census? So it's really that time for all leaders to come together to talk about what their safety concerns are. And also we shout out team members day to day on there too. So we give great catches, big kudos. Every day someone's saying, oh, I appreciate care management for going above and beyond to make sure that patient got home. Even though it was 7 p.m., we got that patient back home so that they didn't have to stay another night in a hospital setting.
That's so nice. Yeah, I can see how all of this it's so safety focused, what we've already covered, but when you just said, like, sending somebody home at 7 rather than keeping them a whole other night in the hospital, that makes such a huge difference.
Huge difference.
Yeah, to a patient and their care. So that aspect I've been wanting to get to as well. So that's another part of your role, which is such an extensive role, the patient experience. Can you tell me, what that means to you in your role and how kind of you oversee great experiences for patients?
Yeah, so patient experience to me means trust. It means empathy. When we look at our patient experience surveys, patients just want to be seen, they want to be heard, and they also want to be able to have a say in their care. And so part of that, we have recently rolled out eye care, and it's a way for our colleagues to connect with patients. So what it means is that we introduce ourselves, that we connect to the patients, and not just connecting on a healthcare level, but connecting on a personal level, asking for permission before we do something, making sure that they have the autonomy in their care. We reduce anxiety and we exit with reverence. So making sure that they know that we're still there and we're willing to come back and check on them at any time, but also giving them time for them to relax, to rest, and to get better.
Yeah, that's great. I know, if you are in the hospital, oftentimes it's something that could cause stress for you and for your family. And so it sounds like, leading with empathy, like you said, and checking on them at every stage of their care, I think definitely sounds like, I know if I were a patient, that would really set me at ease.
Yeah, and our vision is to become the most trusted healthcare provider to our community. And so I think that really drives home when we're connecting with them, that they can trust us, and that we also have the empathy to not only provide them best care, but also recognize that healthcare is not just in the hospital setting, it's also within our community. So we're asking those tough questions. Hey, are you able to pay your light bill? Is there some kind of food insecurity? Is there other connections that we can help within our partnerships between home health care, our Healthy Village model, those things to make sure that the patients not only get well in the hospital, but they get well at home too.
Mm-hmm. That's so wonderful. I have said this, but this podcast series, I've learned so much about how your teams meet people where they are. Like you just said, it's like the light bill might not seem like healthcare, but it is, because it's a part of the whole patient. I love that.
And it's very important because when we go back to, like, if someone is going to go home with a central line, right, which does happen, they call them PICC lines, it's important to have power at your home so you can take care of the line, and home health can come help take care of the line.
Right.
So those are things that matter, that, we really have to connect the dots on patients and meet them where they are.
Absolutely. It doesn't just stop in the
hospital
room.
Right.
Yep. So earlier we touched on that I mean, it's incredible, the CLABSI, like the Becker's rating, and how you all celebrated that. And that was for St. Francis. I know Mercy Fitzgerald has another thing that you'd like to highlight
Yes.
for me. Let's hear a little bit more about, a shout out for Mercy.
Mercy Fitzgerald was just recently had their accreditation through Corazon, which is another regulatory body, and they were actually recognized for their Platinum Heart Attack Award.
Wow.
Essentially, what that means is that we're providing the best care for evidence-based standards for heart attacks. If you look up in America, almost 800,000 patients or community members have heart attacks every year. And so when you're having one of those significant events, you want to go to a hospital that you know is going to get you the best care and the quickest care. So they were recognized, they received the Platinum Award for that. So their
wonderful.
heart attack treatment is top tier.
Yeah, I mean, heart disease affects so many of us.
Affects so many. And with Mercy, a closure of another community hospital, we've seen, a significant increase in volume. And so we want to be there for those patients in that community. And again, to provide the best care that we can.
Right. So just because there's an increase in quantity doesn't mean that you
Correct. Does not mean we never let the quality go.
That's great. This has been so informative. Thank you so much. Anything else that you wanted to add that I maybe didn't touch on today about your role and kind of what patient care means to you?
No, I think patient care means to me is just providing the highest quality of care for our patients to minimize their risk and get them back home. And just knowing that both of our campuses are, being awarded for things through Joint Commission as well as American Heart Association just goes back to show that we are maintaining the best standards and meeting the best care.
Absolutely. Oh, thank you so much, Megan. This has
Thank
been
you.
really, really great. Thank you.
I appreciate it. Thank you so much for having me.
It's incredibly reassuring to know that if you ever find yourself in need of care at one of our hospitals, colleagues like Megan and her team are working behind the scenes tirelessly to make your experience not only clinically sound, but as comforting and positive as possible. To learn more about Trinity Health Mid-Atlantic's unwavering commitment to quality, safety, and patient experience, check out the link in the description below. Thanks for tuning in to Beyond the Stethoscope. Don't forget to hit that subscribe button and follow Trinity Health Mid-Atlantic on social media so you never miss an episode. We drop new ones every other Thursday.